to the To Your Health podcast, your go-to source for everything health, wellness, fitness, and medical insights. I'm your host, Rhonda Alford, and joining us today is a new hematologist oncologist, Dr. Comfort Takang, and she's with Terrebonne General Mary Bird Perkins Cancer Center. Welcome to the show, Dr. Takang.
Thank you for having me.
I'm so glad you were able to join us today. Let's get started with you telling us a little bit more about yourself and your role at Terrebonne General.
I am Dr. Comfort Takang, and I was born and raised in Cameroon, Africa, and moved over to the U.S. to join my family. I've traveled a lot: Texas, Hawaii, Florida, and just finished my fellowship at University of Minnesota. Now, looking forward to serve this community, taking care of cancer patients and patients with blood disorders.
Well, we're so happy to have you.
My pleasure.
Yeah, it's a great place to be. You're not going to find better food or better people than the people that are around here. And it's a lot warmer than Minnesota.
Oh, yeah. I always tell people I got here as soon as I could. Somehow, I found out that Houma was voted the happiest place in the U.S.
It truly was.
And I got here as soon as I could, and I figured out why. Good people, good food.
That's right. That's right. It keeps people happy.
Yeah.
Well, why did you decide to specialize in hematology and oncology?
You know, I get asked that a lot. Growing up, I lost my aunts to breast cancer.
Oh.
And going with her through this process opened my eyes to how complex the field of cancer is and how difficult it is for patients to make those life-determining decisions on a day-to-day basis, and how little we knew about cancer back in the day. And that drove my passion to wanting to join the fight against cancer by becoming an oncologist.
Oh, I'm sorry about your loss. I lost my father to cancer too, so I can relate to that. And breast cancer, we're going to talk a lot more about that in this episode. Why is it so important to create this awareness from a medical perspective?
That's a really good question. From a medical perspective, breast cancer awareness really bridges the gap between advances in research and real-world impact. Awareness leads to education, and education saves lives. The more people are aware of early screening, and the sooner we detect cancer, the higher the cure rates.
Early detection, how has that made an impact in breast cancer?
It has made a tremendous impact. As a matter of fact, breast cancer, when early detected, we have a survival rate of over 99% in 5 years.
Wow.
So early breast cancer, the goal of treatment is for a cure. So we're seeing more and more survivors of breast cancer through early detection.
So that is the key, finding the cancer early. How do these patients, if they are able to get detected early, you mentioned that the survival rate is much higher.
Correct.
And why is that?
This is because of the advances that we've had in our management of breast cancer. So when we detect breast cancer sooner, it's localized in one spot. And so we can target it with either surgery, radiation, in combination with some of the newer technologies we have. And that leads to better outcome and lesser side effects.
What are some of the biggest risk factors for breast cancer?
That's a really good question. So we have non-modifiable risk factors, and then we have modifiable risk factors like lifestyle changes. For the non-modifiable ones, we have things like age, family history, genetic mutations like BRCA1 and 2. We have dense breast tissue, personal history. Those are non-modifiable. And for the modifiable risk factors, these are things like obesity, alcohol use, hormone replacement therapy.
So those are things you can control.
These are things we can control.
And so, what are some of the biggest risk factors that are involved with breast cancer?
The biggest risk factors, like I said, would be age, and that's why screening starts at a certain age. And then we have the family history and personal history, BRCA1 and 2 genetic mutations. Those are some of the biggest risk factors.
And what age should women be screened for breast cancer?
So, according to the American Society of Clinical Oncology, the guideline for the average risk population is to start screening at age 40. And that will entail doing a screening mammogram every 1 to 2 years. And for those at a much higher risk, those with strong family history of breast cancer, those with genetic mutation like BRCA1 and 2, screenings might have to start much sooner, as early as 25 to 30 years of age.
Right, if you have a family history.
Correct.
So, what are the symptoms that we should look for in breast cancer?
That is a very interesting question, and I like that you brought that up because awareness is all about being able to take that first step. And some of the most common symptoms would include a lump in the breast or in the axillary or the armpit area. You could have changes in the skin color of the breast. You could have dimpling of the breast. You could have retraction of the nipple. Sometimes you have discharge from the nipple, either bloody or non-bloody, sometimes with pain. Any change in your breast should warrant you talking with a primary care doctor.
You have to be very observant of yourself.
Absolutely. Absolutely.
Is it possible for men to be diagnosed with breast cancer?
Oh, absolutely. Actually, men consist about 1% of breast cancer diagnosis. And typically men tend to be diagnosed at a much advanced stage, just mainly because there's not a lot of awareness and they're not really paying attention to it. So the same symptoms go for men. Any breast changes warrant, a clinical evaluation.
You mentioned mammograms and getting a mammogram. There's different types, a screening mammogram and a diagnostic mammogram. Can you give us the difference between those two?
Absolutely. I got asked this question not too long ago by a friend. So, screening mammogram is what we do to a healthy or a non-healthy person with the goal of trying to detect a lump or mass or cancer at an early stage. So it's done without any kind of symptom. While a diagnostic mammogram is what we do when someone presents with symptoms or when someone has been diagnosed with cancer and we're following up to see if there have been any changes. So it's more complex. The diagnostic mammogram is more complex and it more detailed.
So, what are some of the latest treatments in breast cancer?
Thank you for bringing that up. It's actually quite fascinating how much advancement we've made in breast cancer treatment overall. Breast cancer is a multidisciplinary cancer, we approach it surgically, we use radiation, and we use other modalities. And there have been advances in all three, mainly with the goal to improve outcomes while reducing side effects. And so, from the medical perspective, most people are aware of the traditional chemotherapy, but we do have other treatment options like the endocrine therapy, which people call hormonal therapy. We have targeted treatment like the CDK1 inhibitors, PARP inhibitors that target specific mutations either on the tumor or in the patient. We also have immunotherapy, which has brought tremendous changes in different kinds of cancers, including breast cancer. And these all have improved overall survival in different ways and also better outcomes.
So there's a lot of advanced treatments these days.
Absolutely.
So what do you share with your newly diagnosed cancer patients, breast cancer patients?
I usually encourage them to take one day at a time and to try to get as much information as possible from their trusted care team, because getting enough information can help with some of the anxiety and fears that come with navigating decision making and treatment. And I also let them know that they're not alone, that they do have a great community support out here for them.
Well, thank you so much for sharing this information about breast cancer awareness, and we welcome you to our team.
Thank you for having me. I appreciate it.
For more information about Dr. Takang and breast cancer awareness, visit tghealthsystem.com. Don't forget to like, share, and subscribe to our podcast where you get your podcast.